Hi, everyone. Welcome. My name is Candace Mutter. I am co-owner and chiropractor at High Point Chiropractic in Burlington, Massachusetts, and I am so excited today to have my friend and colleague, Liz Akincilar, who is, she has her master's in physical therapy, and she is the co-founder and clinical director of the Pelvic Health and Rehabilitation Center, or PHRC for short, both here in Lexington, Massachusetts, and Bedford, New Hampshire. Before we get into our topic of conversation today, you have clinics across the United States, right, Liz?
We do. We started in San Francisco in 2006. We being myself and my business partner, Stephanie Prendergast. And from there, we have grown to several locations in the Bay Area, California. We are in also Los Angeles. And then about 4 years ago, we expanded to New England.
That's great. Now, how do you like being back home?
You know, I really didn't think that I was going to like winter again because I hadn't been in the East Coast for over 20 years, but you know, I kind of like it. I know all of my friends and colleagues in California think I'm nuts, but there's something kind of cozy about the snow. So yeah, I'm happy to be back with the Four Seasons.
That's awesome. Well, it's good to have you. So the reason we are here today, why we decided to collaborate on this interview, is to shed some light on a very important health topic that many people don't even realize is a health topic, right? And that's pelvic floor health. This is your area of expertise, and I'm so excited to pick your brain a little bit about this today. So before we get into those questions, why don't you take a second just to tell everyone a little bit about yourself and how you got interested in this field?
Yeah, so I went to graduate school at the University of Miami. And I really didn't know exactly what I was going to do in physical therapy. So I moved to California. I started working in orthopedics, and something just didn't really click for me in orthopedics. So back then, I went on Craigslist to look for a job, and I actually found a position at a urologist's office that said, you know, treating pelvic pain will trade. I didn't even know that I could treat pelvic pain. I wasn't even sure what pelvic pain was, let alone what I could do for it, but I found it quite interesting. So I spent a day or two with the urologist, and that's actually where my business partner was working at the time. And, you know, long story short, I started working there, really fell in love with the work. I like spending time with patients. I had a whole hour. It was one-on-one. I felt like I was an impact on their lives, and I wasn't rushed by, you know, seeing 2 or 3 patients an hour, and I really grew to love the work. And so a couple of years later, we opened our own practice and started teaching and writing and doing various things, just really getting involved in the work and learning more and more about the field. And yeah, 15 years later, here we are.
That's awesome. Yeah. That's great. So let's dive into our topic. So pelvic floor health. Now, how would you define having a good pelvic floor, a healthy pelvic floor? Like, what is the criteria that we should think about when we think about our pelvic floor?
So I think people don't even know they have a pelvic floor until something goes wrong with it, right? You know, we urinate, we have bowel movements, we have sex, and if everything is working fine, we don't even think about it until something goes wrong. So I think, if you have any difficulty with any of those functions, urinary, bowel, or sexual function, you should always consider that the pelvic floor may be a component in this. And this is, of course, after you've ruled out things like infection or disease or things like that. If you have any pain in the genitals and the anus and anywhere around the bladder, the urethra, again, ruling out infection or disease, you should consider that your pelvic floor may be playing a role in this. So the trick is getting recognition, I think, or getting someone to validate, a medical provider, that this may be part of whatever you're experiencing. So I recommend going to your physician, talking to them about whatever issues you're having. And if they don't bring up physical therapy as a possible treatment method, I would look into it yourself and go online and see who the pelvic floor therapists are in your area to at least rule it in or out as a possible contributing factor to whatever symptoms you're having.
Yeah, that's really good to know. In chiropractic, we do see a lot of, pregnant women, and that we tend to address the pelvic floor, either directly or inadvertently. It comes up in conversation. And there's so many women that don't even realize what normal is and what abnormal is. And not just the pregnant population, but also women in their 40s and 50s and 60s. Sure. So with that, what sort of people do you see in your practice?
So we really see a wide variation. We're probably about 60% women, 40% men. The average age is about 38. So we see the gamut. We see, we see children in some of our offices as young as, 3 or 4, as well as, folks in their 8th and 9th decade. So really a big variance. But probably the most common is going to be, and it's interesting, it's probably the active, fairly athletic person in their 20s, 30s, and 40s, I would say, are the most common. And that's men, women, pregnant women, postpartum, the whole gamut.
Mm-hmm. That's great. So if someone were thinking this is something they need to do, I've certainly sent a lot of people to pelvic floor physical therapists, over the years, because it's such an important thing to be addressed. What can a person expect when they come into your office?
Yeah, it's a great question. I think there's a lot of anxiety around folks when they first come to our office. They don't know what's going to happen behind that closed door, because it's not something that is commonly understood or even known, in our society. So when the person comes in, there is some paperwork to fill out, but we really start with a conversation. It's a behind a closed door, in privacy, and we listen to whatever you have been going through. We listen to your whole story. We want to know when this started, what was happening before it, what kind of symptoms you've been having, what kind of treatment you've done, what has helped, what hasn't, who else is in your treatment team right now, and everything around it, medication, surgeries, everything in your medical history. Then we step out, we let you get undressed from the waist down, and then we do a physical exam. And that physical exam entails addressing the muscle and tissue externally. We say from the ribs to the knees, front and back, and we're looking for impairments in either muscle or tissue. And then we do an internal exam, which is one gloved, lubricated finger, either a vaginal exam or a rectal exam, and then we assess the muscles and the nerves of the pelvic floor. And just like we would assess the muscles of your leg, we're assessing the muscles in your pelvic floor. We're looking for tension, trigger points, which are taut bands within muscles. We're looking for motor control. How well can you contract your pelvic floor? How well can you relax it? Do you have discomfort when these muscles are touched or palpated? And then we also do a neural exam. Do you have sensitivity upon touching various nerves in the pelvis? And then after the exam is over, we talk about what we found and what we think, putting all of those findings together and how they may be contributing to whatever your symptoms are and how we may be able to contribute to resolving those symptoms.
That's great. So I'm assuming you have different care plans for different people, right?
Absolutely. Individualized, Absolutely. You bet. Yeah.
Very individualized. Okay. So what about you guys, though, at PHRC? What makes you guys unique and special?
Yeah, it's a great question. So I think the thing that makes us the most unique is we are really willing to kind of be the captain of your ship, so to speak. Many people come to us and have had to be their own advocate through their process, through their symptoms and sometimes their pain syndrome. And we really are willing and want to and are able to take on that role of, who else do you need to see? How can we create a multidisciplinary treatment plan for you that really, gets at each of the aspects that we need to address in order for you to get the outcome that you want? Many patients don't know where to go or who to turn to because, frankly, there aren't a lot of providers that are well-versed in treating pelvic floor disorders or pelvic pain. And we have a very good network, really, nationwide and in many other countries where we have colleagues that we often work with and we can get you in touch with them. So not only do we take care of the physical therapy aspect, which is said very individualized, but we will help you get to the other providers to really help you reach those goals, because as we have been speaking about, a multidisciplinary approach is absolutely necessary for most of these folks.
Yeah, very much so.
Yeah.
So along with chiropractors, what other healthcare professionals do you work alongside?
Yeah, so urologists, gynecologists, pain physicians, acupuncturists, mental health specialists, whether that's a sex therapist or a sexologist or a cognitive behavioral therapist, other physical therapists. We often collaborate with therapists that, may have more of an expertise in orthopedics or the back. We work with a lot of family physicians and internal med because often they're the gatekeepers. They're the first kind of person that people go to when they have an issue come up. So we really try to educate those folks and work closely with them. We work with nutritionists, we work with colorectal physicians. The pelvis spans a lot of different systems. So there's a lot of providers that sometimes we need to incorporate in order to get the outcome that we want. Yeah,
that really speaks volumes, though, that you've cultivated those relationships because people need the help. It takes a village sometimes. It really does. Yep. So you are also an author. So how about you tell everybody about your book?
Yeah, so a couple of years ago, Stephanie and I wrote a book called Pelvic Pain Explained. And, we did this because, when we started the process, and it was a process, there really wasn't many resources out there for the patient about pelvic pain. There were a couple of books, but there were very, very little resources. So we thought, we really want to make something that patients, it's easy to read with, to really guide them through that process. Like, okay, I have these symptoms. Where do I go from here? Who do I see? What questions do I ask? What kind of providers do I need to look for? So that's how we wrote it, really, really to help the patient navigate the complex terrain of pelvic pain. And in there, we have some success stories to show that, yes, people actually do get better, and it's not all a black cloud. Lots of people get better. So yeah, that was the genesis. So it's been a couple of years, and we've gotten lots of great feedback, and we're really proud that it's a resource for those patients.
Yeah, definitely. That's amazing. So what's it called, and where can people get their hands on it?
Yeah, so Pelvic Pain Explained is the name of it, and you can find it on Amazon, or you can find it on our website.
Oh, that's awesome. Yeah. And in terms of care, so if someone was interested in seeing you, where can they find you? And is it possible for them to have a consult to see if you're a good fit?
Absolutely. So we have, like I said, we have three locations in New England. We have Lexington, Mass, Natick, Mass, and Bedford, New Hampshire. In California, we are in San Francisco, Berkeley, Los Gatos, Walnut Creek, Los Angeles, and Westlake Village. All of that info is available on our website, which is pelvicpainrehab.com. And yes, we do offer complimentary 15-minute phone consultations if you are curious whether this is the right place for you, if the symptoms that you're experiencing could be helped by someone like us. So you can check out our website, and you can actually put in an inquiry in our website, and someone would get in contact with you.
That sounds great.
Yeah.
Well, thank you very much for lending us some of your time today to talk about this very important topic. And I really hope that some people in the audience will reach out to you. At a very minimum, pick up that book on Amazon.
Thanks so much.
Thanks so much.
Thank you.